So when a patient comes into our practice, we do a CT scan. A CT scan is a three-dimensional view of the jaw. So we're analyzing if a person has a root canal and the root canal tooth has an infection, and we see a periapical radiolucency, or the patient has a root canal and they are coming with pain. Obviously, the patient is coming because the root canal failed. The patient has the option of seeing an endodontist, or they have the option to remove that tooth. What we do is that when we remove a root canal tooth, we send it for a DNA biopsy. We have never, in 28 years, have a root canal come clean. The DNA biopsy of a root canal has always come full of bacteria. Some people don't have any pain on the root canals. Some people wait for them to have a problem with the root canal, but a tooth that is a root canal is a dead tooth. It's a dead tooth and it has no blood flow, so you have that tooth stagnated on the jawbone, and then that's connected to other parts of the body. So we have stories. I can do a documentary of the stories of the root canals. So a root canal is a tooth that for some reason either the tooth got infected or died, and the patient had the option to take the tooth out and replace it with an implant or a bridge, or perform an endodontic procedure where you remove the main nerves and try to sterilize the tooth. If the bacteria that was in the tooth is in the jawbone and the bacteria cannot go up, it starts eating the jawbone around the tooth. The problem with that is that that tooth, the root is connected to the arteries and to the nerves, and then the bacteria can travel through the arteries and the blood vessels into other parts of the body. A tooth is an organ that has a neurological system. It has nerves, right? Because if you have a toothache, it hurts more than giving birth to a baby, some people have said, right? It has maybe 2,000 nerve endings. A molar can have 3,500 nerve endings. That's a lot of nerve endings. And then a tooth has a vascular system. It has veins or little arteries that bring the blood flow and bring the nutrients to the tooth to make it alive. So when a tooth starts dying, because you had a trauma, an accident, the decay went into the inside of the tooth and ate the tooth and damaged the nerve. When somebody does a root canal, the doctors are trained, we're trained when we learn how to do a root canal, to remove the main nerve of the tooth. And also you see blood, right? If the tooth is still alive with say pulpitis, you can see the nerve and you can see the blood. So you're removing the tissues, the soft tissues inside the tooth. That was making the tooth alive. So now that you remove that, so the dead tooth is going to be treated with formaldehyde, for example. It's called formocresol. It's a mummifying agent that is used so the tooth doesn't rot inside your jawbone. So then they fill the canal with a gutta percha, which is a plastic material that is cemented in. They top the nerve tissue that was removed with some plastic, and then they might put a crown on top of it. So now you have a dead tooth. How long does a root canal last? You know, it's not going to be forever, but some people have it for many years and then the tooth starts deteriorating. Some people have a root canal done and then they get an abscess because the bacteria from the areas that they were not able to penetrate. I don't know of any technology that can actually kill the bacteria that are in all the tubules, because you have the main tubules, but then you have dentinal tubules that go this way, and they're full of bacteria. So even if you use a laser, laser dentistry, they're trying to do ozone, they're trying to come up with things, but still, it doesn't matter what they do, the tooth is dead. So, a dead tooth, a dead organ is going to dry up, it might fracture. That's why, the doctors try to put a crown on it to see if they can get more longevity. But a root canal, the chances are that it's going to have to be replaced at some point. The option is given, do you want to replace it when it breaks or gets infected, or do you want to do it before you go through that process? So some people, choose to remove the tooth and then heal the jawbone with plasma and bone, and then put a ceramic implant.